Hi, good afternoon, and welcome to the fourth scientific overview Ask the Expert session, sponsored by MRF and OncoSec. I'm Kelly Malloy, the Chief Operating Officer at OncoSec, and I will be moderating this session. I'm very excited to continue in this series of Ask the Expert and continuing with the partnership that we have with MRF. OncoSec is a late-stage biotechnology company developing immunocancer treatments using our plasmid DNA delivery platform. And through that proprietary technology, we're working to deliver safe and effective cancer treatments that can provide long-term benefits. Our primary technology is tavokinogene telsoplasmid, and it's a potential treatment for multiple cancer indications, either as a monotherapy or in combination with leading checkpoint inhibitors. In particular, meeting the great unmet need of anti-PD-1 non-responder. Education is critical for patients to make informed decisions about their care, and we are thrilled to partner with the MRF on their Ask the Expert series, which is touching on topics to help educate and empower the melanoma community. If you missed our previous sessions, you can view them on the MRF's Facebook page. Thus far in the series, we have discussed clinical trials, the role of care partners, and immunotherapy. Today is the fourth session, which will be focused on upcoming scientific conferences, specifically the Society for Immunotherapy of Cancer, SITC, which is happening November 9th through the 14th. In addition, in this conference, we will be discussing other scientific conferences overall and how patients can benefit from the information that is shared at those sessions. SITC is the world's leading member-driven organization specifically dedicated to improving cancer patient outcomes by advancing the scientific application of cancer immunotherapy. There are other scientific meetings such as ASCO, ESMO, or SRM that are vital to the progression of melanoma treatment and advancing a patient's personal journey. These meetings are attended by researchers, clinicians, industry partners, and advocacy organizations. So without further ado, I would like to kick off this session officially and introduce you to the panel of experts that we have at this session, starting with Dr. Glenn Merlino, who is the Senior Investigator and Head of Cancer Modeling at the Cancer Research Center at NIH and the National Cancer Institute. Dr. Merlino has contributed through his career to the public's understanding of receptor trisosinase kinase signaling, oncogenic transformation, transcriptional regulation, cell cycle regulation, multiple drug resistance, and genomic instability. Currently, Dr. Merlino's goal is to develop improved preclinical melanoma models to study inherent and acquired resistance to targeted and immune-based therapeutics. Dr. Merlino is also the co-chair of MRF's Scientific Advisory Committee. With that, I would like to welcome Dr. Merlino to this Ask the Expert session.
Thank you very much.
Thank you, Dr. Merlino. In addition, Sandy Leachman, Professor and Chair of the Department of Dermatology and Director of the Melanoma Research Program at the Knight Cancer Institute, and Professor of Dermatology at the School of Medicine at the Oregon Health and Sciences University. Dr. Leachman is the inaugural recipient of the John D. Gray Endowed Chair in Melanoma Research and Chair of the Southwest Oncology Group Melanoma Prevention Working Group. She's a dermatologist using basic science and research and state-of-the-art technology to combat skin cancer. Her clinical interests include skin cancers, especially melanoma, pigmentary disorders that result from abnormalities of melanocytes, such as vitiligo, and genetic disorders that involve the skin, such as paracinchona congenita, Coden syndrome, and other cutaneous cancer syndromes. In addition, within this panel, we have Dr. Christopher Twitty, who is the Chief Scientific Officer at Oncosec Medical. Dr. Twitty brings over 12 years of experience in tumor immunology and cancer immunotherapy, including the discovery and the development of Oncosec's leading clinical immune monitoring and biomarker program. Dr. Twitty earned his PhD from Oregon Health and Sciences University, where his work was focused on novel tumor vaccine strategies, and was awarded an American Cancer Society Fellowship training grant for his postdoctoral studies in Bernard Fox's molecular tumor immunology laboratory. After developing a preclinical and clinical immunological program focused on glioblastoma at Tokagen, Dr. Twitty joined Oncosec. Previously, Dr. Twitty has held scientific positions of increasing responsibility at Bayer and Cellgenesis Incorporated. And with this tremendous expert panel, we will kick off with our initial questions. There will be an opportunity for everyone participating and viewing on Facebook to ask questions, which can be shared with our experts. And so with the first question, I will hand it to Dr. Merlino. Could you share with us what SITC is and how it differs from other annual scientific meetings and conferences?
Sure. First of all, I'd like to say thank you for inviting me. It's an absolute pleasure to be here to talk to you today. It's just great to operate in this kind of system where we can't be together, but we can talk together. So SITC is the Society for Immunotherapy for Cancer, and it's existed now. This is the 35th anniversary. So what you need to understand to appreciate this organization is that everybody thought immunotherapy was going to be perfect for melanoma years ago. And it just never happened. It just didn't happen. And people knocked their heads against the wall, and it went 10 years, it went 20 years. And it really wasn't until the breakthrough of CTLA-4 that we got to the point where the immunotherapy is now taking off. And it's the greatest thing since sliced bread. And so SITC gets a lot of credit for forming this organization for scientists, advocates, patients, bringing all these people together to think about immunotherapy for all these years before it really hit the big time. And not only is immunotherapy the best thing since sliced bread, but melanoma is the poster child of immunotherapy. It was the original disease that showed that it could work. It continues to be frontline therapy for melanoma patients. So SITC gets a lot of credit. Their focus is on immunotherapy. And in today's world, immune checkpoint inhibitors, CAR T cells, cell therapy, immunotherapy is their thing. And so not only do they get a lot of credit, but they do a fantastic job of bringing this information at its most, cutting edge surface to all the people who come in to participate, which includes scientists and advocates and patients. And we'll talk about a little bit about the program later, but clearly they do a terrific job of bringing cutting edge, basic and clinical research to all the people who participate, and there's great communication between them, and it's just a meeting that you really don't want to miss.
Thanks, Dr. Merlino. For our next question, Dr. Leachman, where can patients learn of information that is shared and discovered during these scientific conferences? And second, what are some of the most beneficial topics that are discussed at scientific conferences, which are applicable specifically to patient care?
Yeah. Well, first of all, I wanted to step back for just a second to say that SITC, you heard all about SITC, and it is, platinum level conference standard. I mean, you don't get any better than SITC to learn about immunology and immunotherapy for cancer. So, but there are other things that you might want to learn about. So you might want to think about, depending on what your interest is with respect to melanoma, there are other conferences like ASCO and ESMO, and there's other surgical conferences. There's, and dermatology conferences. And so the world is kind of wide open. And one thing that's great about conferences is you can look to see what conferences are happening and what the topics are ahead of time. Nearly everything is posted online. And so you can find those, and you can really use just the agenda itself to sort of help you identify the hottest topics and the ones that you're interested in learning more about. Then, you can do Google, you can search for your topics just like everybody knows how to do that, but there are news alerts on news feeds and Twitter. There's meeting reports that come out, and I would say that a lot of times that is also a very helpful thing when a report from a conference comes out, because most of the time they bring the people who are most relevant to that topic to the table to discuss it. And so you really get insight from the world leaders about what they think about that particular topic. And that's published. So that's also been through a peer review and questions and answers from the whole community. So I think that's a really important thing. With respect to what's most beneficial, I think unquestionably it's that you get new data. And a lot of that data not only is new from the perspective of something that's just come out, sometimes it's even pre-publication. And when you see that helps you to know that there's what is coming on next. What's the cool thing that's coming up next? And people get together in certain sessions, and there's a certain synergy that happens in a meeting that just doesn't happen when you're independently working in your lab in isolation or publishing in isolation. And that's the kind of thing that I would look out for what is the real benefit of tracking a meeting in particular. So I guess that's it. Any other points that you want me to comment on?
Thanks so much, Dr. Leachman. I think that's important, the walkthrough of how to get the information and how to distill it down. And there are so many important scientific conferences that are going forward. I think right now we're highlighting SITC because it's coming up. And as you said, Dr. Merlino, it is very different in that it was kind of ahead of the actual therapy being able to be available, but has really taken off and exploded and created a great opportunity for new treatments and new therapeutics to come forward. So Dr. Merlino, I'm going to turn back to you and ask if you can describe how research that is shared at SITC gets translated into those new treatment options.
Yeah, so that's a good question. And I think to answer it, I might have to tell you a little bit about how the situation we're in today, the pandemic, has affected all sides of this. So one of the silver linings of this is we've all become very facile at these sort of virtual meetings. And so it's not just, people who are more lay people who have all different kinds of jobs, non-scientists. Even for scientists, we can go to meetings all the time if we want to. There's always meetings going on. And so you can do the same thing. You can go through, just as Sancy said, find all these meetings, register, go on and learn, cutting edge stuff, what people are thinking, what they're doing right now. But I do have to tell you, there's a downside of this for the scientists. Scientists, even though we have to travel to these meetings in the past, there was something major that was gained in the traveling, and that we'd all be together in the same space. And we wouldn't just be listening to each other's talks, we'd be communicating with each other between talks, between sessions, at lunch, in the morning, when you're having coffee. And I have to tell you, that is missed, because that's when a lot of communication happens. That's when a lot of ideas flow. So that's just the caveat in how the pandemic has a little bit handcuffed the scientific community. But then and now, the data that comes out at meetings like SITC is, hot off the press. Sometimes people come in and they just finished an experiment the next day. Sometimes their postdoc sends them the slide that morning, and there it is. And they tell you, right, what just happened. That is a tremendous thing for scientists, because they can take that information, and that slide could move the field, that one slide. So they take that information and they go back to their lab and they share it. How does this help us understand what we're looking at? Does it affect us? Are we going down a wrong turn? And that kind of information is absolutely invaluable. So the other thing about this meeting is this is for basic people, clinical people, and those who translate between the two. And every one of them benefits from this. The clinical people, they take their, like Keith Flaherty, for example, is one of the superstars in the melanoma field. He knows all about the basic stuff. He's one of these people who can do, soup to nuts, basic to clinical. He'll go to these meetings and he'll not only tell you about new things that he's learned, but he'll learn from people that he's heard from and how he can apply that to his clinic. And that's exactly what happens. The basic and the clinical people communicate with each other, they share information, and it makes each one of them better. And so then they go back and they take advantage of that to help patients in the clinical trials and to help researchers make new discoveries to then in turn help the people in the clinical trials. So that's how it's all supposed to work. A little bit handcuffed now without being together in person, but you get to benefit from this because you can go to so many meetings now.
Thank you, Dr. Merlino. I'm going to hand it back to Dr. Leachman and ask, what advice would you give to patients when they are self-advocating and navigating information that's made public through scientific conferences? What specifics should patients look for? How can it be translated into layman's terms? Because a lot of these meetings are very heavily scientific, and just translating back to the patient in a language that is understandable. How do they find that avenue? And can you discuss the importance of patients being their own advocate? Sorry, that was a whammy of a question, but I know you'll have.
Yeah, that's a lot of, it's several different questions. So I'm going to start with one. I'll just move from question to question a little bit. I think that the first thing is what's the thing that should be on the top of your mind? And I always say, caveat emptor, right? Buyer beware. So information is kind of the same thing. Information is you're buying that in a way when you're learning it. And you do need to think about when you're getting the information, who you're getting the information from, and whether there's a bias, either a conscious or an unconscious bias to any of the information that you're getting. Because I will tell you, everyone is biased. Right? Everyone is biased. The point is finding out all of the information from all the different sources that you can, if it's really important to you, because that's the way you're going to narrow in on the truth, on what the real truth is. And so, anybody can. So, for example, we think about investigators that are doing clinical trials who are very, very. You don't think about them as being biased, but we want so much to find something that's going to work that sometimes even we can be blinded and be so certain that something's working, and until that double-blind, randomized prospective trial comes out, we don't really know that, right? So I just say anybody can be biased. So just think about that, I think. The second point about that is, well, how do you overcome that? Well, data is king. And queen and prince and princess. I mean, that is the big thing, right? And what you need to find is some way to get help in interpreting what that data really means at a lay level, because it is difficult to understand, and very few people, I need help from like Glenn and from Chris. I need help interpreting some of the hardcore basic immunology science, and they probably could benefit from a little bit of my dermatologic expertise too, right? So even within the expert group, we need help. So of course, someone who's a patient or an advocate, you guys need to find somebody that you can trust that can do that. And these kinds of conferences that are going on, like this one right here that we're on, this is a perfect opportunity for you to get in more depth what those questions that you have might be. So I really encourage everyone to, if you're having something that you don't understand, this is the time. This is the perfect time to ask those kinds of questions. And then I think the last question was about what I think about self-advocacy. And one of the things that, I don't know if anybody knows this, but this is one of my platforms. I mean, this is one of the things that I get up on my soapbox and talk about all the time, is that I believe that the best patient is an informed patient. I mean, it's like, what is it, the Gentleman's Warehouse or whatever that was, the best customer is an informed customer, and then it's absolutely true for patients. And I think that how do you become informed? How do you get there? How do you advocate? The main way is through questions. Questions. There is no such thing as a bad question. Really, truly, there isn't. And you need to get, somebody. I think a lot of the topics that have been prior to this one through the Ask the Expert series from MRF have been really hitting on those ways that you can do it. So, for example, getting a personal advocate to go with you, right, to go with you to your appointments so that you don't have to be responsible for remembering everything. Somebody can take notes. Someone can hear the other side of something that the doctor might be saying that you might miss. Making sure that you keep track of the answers to the questions and things like that. Getting access to people like us through your doctor can also be another way that you can advocate for yourself. But really, the number one thing is asking questions and getting the information so that you have a foundation to make decisions that are in your best interest. Absolutely critical. So I went on and on, but I did answer like 3 questions.
No, you did not go on and on and on, but you did answer the 3 questions. So thank you so much, Dr. Leachman. And the next one is, with SITC coming up next month, Dr. Merlino, what are some topics or sessions that you are most interested in attending and learning about? And I know that the agenda is still in development, so this might be a little bit of a guessing game on some things that you think might be presented. But it would be great to hear actually from all 3 of you what you might think are some up and coming topics of interest.
Well, so first, I think I should mention that I think Sansi's getting all the hard questions. I'm getting the softball questions, but that's okay with me. So I'm going to answer the question a little bit more about not so much what would interest me personally, but what I think advocates and patients would get the most out of. So if you look at the early agenda, they're going to have sort of pre-conference workshops and primers. And I looked at these. I think they're terrific. I think I would learn a lot going to these. Certainly, in many cases, there'd be information at a really basic level that would probably, fill in a few gaps for me. So I would recommend those for everybody. And I think those are mostly going to be on Monday and Tuesday. In addition, keynote speakers. Keynote speakers tend to give more general talks. They don't get into, protein gels and DNA sequencing data and all that. They tend to talk more at a high level. And I like to get those because I do get a lot out of them. And I think you would also. In particular, on Monday, there's a workshop on immune-related therapy. Heavy hitters, Steve Rosenberg, Carl June, Tony Rebus, Suzanne Topalian, a lot of other very well-known people who are excellent speakers. I would not miss that, and I probably won't. In terms of individual topics, I just think there's breaking areas now. And if you feel like you'd like to know, right at the tip of things, right at the tip of the iceberg, where things are going to be breaking. So there's a session, vaccines have been very challenging and a bit discouraging up to now. But I'd like to know what's going on with them, because if we can get them to work, it would be tremendous. And I think there's a session, I have numbers, but I don't know if they're going to be the same. So there's one on Tuesday, and I think there's one on Thursday. Also, very much important, I think, is toxicities and adverse effects. There's one early, I think it's session 4 on Tuesday, and then there's one on Thursday. They have session 105. I hope this doesn't change. Metabolism is a very interesting thing, and that's on Thursday. I think it's session 211. And then tumor microenvironment is one of my favorites. Everybody used to think that it was just a tumor cell. Now it turns out the tumor cell is, yes, a very big part of it, but by no means the only part of it, and that's on Thursday. Then radiation and the combination of radiation with immune checkpoint blockade is, I think, a very interesting area that might take off, and that's on Wednesday. Some very new and upcoming therapies, neoadjuvant therapy, cell therapies, that'll be on Wednesday. I think it's 106 and 107, but sometime in the middle of the day, there'll be back-to-back sessions on that. Another very interesting topic is microbiome. That is how cells that are not you, that are part of your body, like the bacteria that live in your gut, can influence everything from how the cancer develops to how it responds to therapy. And very interesting, prebiotics, the things you can take in advance that might change what's growing in your body and how that could affect how you respond to therapy. So just a final note then on melanoma itself. I don't want to just pick people out, but I'm going to pick a couple. Jennifer Wargo is speaking on Friday. I think it's session 215. She's a fantastic speaker, very clear. I'm sure you'll get a lot out of her talk. Then there's other sessions. I think 2 and 3 on Monday have melanoma speakers, and that's in the sort of early part of the meeting. So those will be very clear and understandable, I'm sure. The microbiome and prebiotics I talked about in session 108, they'll have melanoma components. And then Yardenia Samuels is going to talk about sort of the immunogenomic landscape. I think later in the week, maybe session 301. That's going to be a little bit high level, but that's the stuff that we look at and learn so much from in sort of where we go with the research and how to formulate ultimately clinical treatments. So I think you'd be interested in all those things, but again, I would stress workshop and primers early on, keynotes throughout, and then the melanoma pieces that show up.
Thank you, Dr. Merlino. Dr. Leachman, anything to add to that? I think that was a pretty comprehensive overview of what to pay attention to, but anything additional that you'd want to add, or Dr.
Well, the only other thing that I would say, I would be happy to invite anybody who's interested. We're in Oregon. We've established a sort of a statewide program called the War on Melanoma, and it's a statewide early detection program for melanoma, and we have a registry where we allow people who are interested in doing trials and studies on melanoma early detection and predisposition. We make them aware of studies that they could be participating in, and it is actually open to the whole nation, not just Oregon. It's just that we have the big statewide emphasis in Oregon right now, and I would love to invite anybody that wants to be a part of our team. We're trying to knock out melanoma from the other side, from preventing it from getting to being bad so you don't need therapy as much as possible. So if we can hit it from both directions, maybe we can just eliminate the disease altogether, and that's where we're going.
That's wonderful. And Dr. Twitty, any additions?
Yeah, I think Dr. Molina did a great job of really highlighting all the pieces. I think I would just echo that. One maybe small detail I would put it may be too granular to Dr. Molino's point, but I actually always enjoy going to the Young Investigator Award sessions, and you really get great energy from, and now as I get more gray hair, it looks to be that these are barely out of high school, but the work they do is incredible, and it really is the future of immunotherapy. So great work and really good energy. So I would just maybe add that little piece.
Thank you. That's fantastic. So I know we are planning to just have a few updates from Dr. Twitty just to talk about the latest developments with TAVO and our overall platform. And then we will move to the questions from viewers so that we can make sure that we answer your questions for today. I do think that from the updates, Dr. Leachman, we obviously will make sure that we get information out about the database that you have for the statewide, the registry for early detection. We'll make sure that that's shared. We'll also make sure that general information about SITC is available following this session. So Dr. Twitty, I will hand it over to you.
All right. Well, thank you so much for the invitation to share a little bit of background on our company and our platform. And so I'll just give you a quick background on really the key element to our immunotherapy, and then maybe just spend a moment or two talking about our lead program and where we're heading. So as Kelly said, I think she did a great job of giving a background, and really we are focused on waking up and using the patient's own immune system. This is immunotherapy, and it differs, of course, from chemotherapy or other therapies, targeted therapies, but it can work in concert with those as well. And what we focus on is a small immunoregulatory protein that allows the immune system to talk to each other, and this is called a cytokine. The one that we leverage with our platform is interleukin 12. And IL-12 has been around for a while. It's actually been in many clinical trials dating back to the 90s and 2000s, and had some success, but unfortunately was fairly toxic when it was infused in an IV setting. So we have actually sort of taken the concept and tweaked it a little bit. And what we do is have a DNA encodable version of this. So it's basically IL-12 is put into a plasmid, which is a small circular piece of DNA. That DNA is injected into the tumor, followed by a quick pulse of electricity, and this is known as electroporation. That little circular DNA is taken up by the tumor and any surrounding cells, stromal cells, and then the tumor itself produces the IL-12. So what you end up with is a very focused local expression of IL-12, which is very different in terms of the earlier systemic types of approaches. And what we find is that we have a very favorable safety profile. So we're likely having very less, the amount of IL-12 is much different than given bolus IV. And also mechanistically, when you introduce IL-12 in a very focused local environment, you can imagine it would have a sort of play a different role in terms of how it interacts with the immune system. So if I can just pause there and give you a quick overview of IL-12. If you think back or look at IL-12 in a canonical sense, you might imagine a pathogen and maybe a bacteria coming in through a cut in the skin and sort of activating some of the innate cells, such as a macrophage or maybe a dendritic cell. And those typically are the producers of IL-12. And they can interact with natural killer, other innate cells that are kind of roaming and sort of looking for this type of behavior that's an infection, and activate those cells. And so we find a similar sort of something happening in line with that. We have an earlier innate side where the IL-12 that we've introduced now through our platform, through this electroporation, getting activated. And that early wave of activation triggers what we call a feed-forward loop. So the IL-12 that we provide triggers and activates some of the earlier innate side to produce a different cytokine called interferon. And that feeds back onto macrophages and dendritic cells and other cells that can sort of help to drive the next wave of the immune response, which is an adaptive wave. And those are the white blood cells that we know as CD8 positive TILs or killer cells. Everything, all sides of the immune response are important, really. But we find that this adaptive, particularly the CD8 positive TILs, the tumor infiltrating lymphocytes, seem to be very critical. So there's this natural handoff as the IL-12 that we've introduced drives this loop of interferon gamma, which can activate other innate cells to produce more endogenous IL-12, which then produces more interferon, sort of in a positive cascade, eventually triggering this adaptive wave of the CD8 and CD4 positive T cells to come in. And really this reshapes the tumor that we treated. And as we all know, there's many tumors that we cannot access through, that are potentially in the lung or bone or brain. And so the beauty of this platform is that we see quickly systemic effects. We can see that the IL-12, which is known as TAVO, Kelly told us, we call this TAVO or plasmid IL-12, can have effects beyond that treated tumor. This sort of, we see it in a monotherapy setting, we call it abscopal response, or in combination, we can see distal untreated lesions regressing, and a whole bevy of immunology that we can interrogate, aligning with that evidence, that is, that we're seeing a strong sort of, we call this an in situ vaccine, sort of this concept of treating one tumor and having that tumor produce an immune response, train an immune response that can then go systemic. So that's our platform, and we're frankly very excited about it. And there's lots of applications. We've used it in different indications, but certainly melanoma is our most advanced clinical program. And for those going to SITC, please keep an eye out. We have submitted the abstract. We're waiting to see sort of what happens there, if we will get a podium, if we'll get a poster, but we will almost certainly be discussing our latest data. And that is specifically in patients who unfortunately progressed on a checkpoint therapy. This is anti-PD-1 therapy that they progressed on. They come on to our trial and then receive our TAVO in conjunction with the retreatment, essentially, of that anti-PD-1 therapy. And so we're seeing very exciting data. Unfortunately, I can't get into the details there, but it'll certainly be at SITC. What I can tell you, though, is in those patients, what we do see as the patients come on to the trial, their tumors are very immunologically devoid. They're very what we call cold tumors. We do not see a lot of immune infiltration. It's mostly just tumor in there, unfortunately, and it sort of makes sense if you think about it in that regard. But our therapy is able to inflame not only that tumor, but distal tumors as well. So very excited about where this platform is heading, particularly in that subset of patients. But it's not limited to that. We are also moving earlier in the treatment paradigm. I think there was some brief mention from Dr. Melino of a neoadjuvant concept. So we're going to be leveraging our platform in patients that will typically go and have their tumor resected. So earlier stage patients, we strongly believe there will be a big impact on those patients as well. And of course, other indications that we're looking to treat as well. So this platform is very adaptable. And one last piece, I know I'm pushing my time right now, but one last thing I'll mention is, because this is a DNA encodable platform, we can easily look at the data, particularly the biomarker data as it comes in, understand where there may be bottlenecks in some of the patients who are not responding, or maybe things that we can do better in those that are responding, and learn from that, and then encode another gene that could complement or synergize with this cytokine. And that's what we're doing in our next as we evolve the platform. And so we'll be looking to add a cytokine to help advance trafficking. And I don't want to get into the details too much here, but it's a very plastic platform. So we're quite excited about it. And anybody who has questions, please reach out to myself or Kelly. We'd be happy to talk at length. As you can tell, I'm getting a little too excited right now. So I'm going to pass it back to Kelly, and thank you for your time.
Thank you, Dr. Twitty. Really appreciate it. And I think we talked a little bit about bias. I think he and I both have a bias that we think this can make a difference, but we have to have the research completed, and that's the process that we're in right now. So we do have a few questions that have come in, and it is time where viewers have the opportunity to ask questions. If we get to a point where we've run out of time and we can't answer questions in the meeting, we will direct answers back to you following the conference, and make sure that we answer each and every question that have been raised. So again, we really appreciate the engagement from our experts in this panel. And I will start with the questions that we have received so far. So Dr. Leachman, are there any specific conferences that are open to the public or open to melanoma patients?
Yeah, so I actually just typed that into the chat. I saw that chat, and there's two different ways that you can do that. First of all, if you go to the registration, every meeting has a web page with registration on it, and you can always go to the registration and see whether non-members can register. And so in some cases, you're allowed to register as a non-member, and you can attend the meeting, and a lot of times it's at a lot less cost. If it's a really high rate, sometimes the second way is to find out whether there are non-scientific memberships allowed. So some societies that are running these conferences have advocacy-based rates that for membership. And so you could join as a member, and then you'd be a non-scientific member of the community. And those are two ways that you can definitely do that at many of these meetings. I'm not sure about SITC. I don't know if Glenn or Chris know. Does SITC allow non-scientific or advocacy memberships or registrations?
I think they do, because I think a good percentage of the membership is actually advocates and patients. So I haven't looked at the registration yet, but I can't imagine that you couldn't register for this meeting.
Yeah, that makes sense. I mean, it really makes sense. We want everyone who's interested to be able to be there.
As an alternative too, for those that can't make it, for what I think is an excellent way to sort of get highlights from meetings, and as well as scientific paper, they do a great job of sort of breaking it down, is a website called ACIR, Accelerating Cancer Immunotherapy Research.org. And they typically will summarize some meetings with a few high points. It's very high level, but I think it's a great place to start in terms of understanding some of the basic science and some of the more even complex science as well.
Great, thank you. So next question for Dr. Merlino. Where are some of the best places to find some of the information that's discovered at scientific conferences? Chris, you got that ahead, but certainly Dr. Merlino, if you have additional. And what can we expect from this year's conference? So those were two questions for you.
Yeah, so that was a great answer from Chris, and I would add a little something else. Most of these meetings, a lot of them have an associated organization. For example, the Society for Melanoma Research and the MRF. And so after each of the meetings, it's in the best interest of the society for publicity and for showing how much they do, which they do so much, is to put something out on their website that has a summary. And again, it's pretty high level, but I think it's really good to read and it's easy to read. And so like the Society of Melanoma Research will have something on theirs. SITC, I'm sure, will have something on their website that has a summary. And these are really good summaries. And then in addition, a lot of times after an important meeting, you might find in the literature, and you'd have to sort of Google this or something like that, you might find in the literature something that summarizes very succinctly the most important points about a workshop or a meeting that came up. And those are really useful too. And some of them go into a lot of detail and some of them don't, but they're all worth looking at. In terms of the second question, yeah, I mean, I've been just looking at the agenda for the meeting, and what do you expect out of the meeting? I guess it depends on what your expectations are. If you want to see sort of bottom line things, then if you go to the clinical parts, they'll have, really they do, up to the minute sort of findings, anything that has been made, that's been opened up, and that they have the data, they usually tend to show it. So you get to see really very, very breaking clinical data. If you want to go to just learn about cancer and melanoma and what's going on generally, then as I said, the primers and the workshops are terrific. You should go to those. If you really want to get into the weeds, then they have some basic sessions that you can get into, and you can follow pathways and phosphorylation sites and all the stuff that Chris was talking about. So it has something for everybody. And I think that's one of the beauties of this meeting, as well as some of the other ones.
Great, thank you. Okay, I'm going to keep going through the questions that we've received. Dr. Leachman, how can a patient or patient advocate, I think we've sort of covered this, attend a scientific conference? So that was one more question. And I do think, certainly you can go through more, but I think you have answered that.
Yeah, I agree. I don't think I have any much more to add, except that as we get back to in-person conferences, I bet that there's going to be a video virtual option for most conferences that's going to be retained as part of how we do things going forward in the future. And so it may be that you don't have to go in person. It used to be you had to go in person. Now you can maybe do a combination or just go virtually, and you can make more of them if you want.
Yeah, and also this year with COVID and needing to go virtual, there are some conferences that have set up the free virtual access for patients as well. And I think that is something that I would hope they do continue, even as you said, when things go back to live in person. So the next one is for Dr. Merlino. What is some of the best research that has come out of SITC? So looking more historically, what are some of the bigger research news that has been?
Yeah, so I do want to clarify that there are a lot of these groups, these members, the societies. They actually have grants that they give out. So they actually facilitate the research by funding it. So the MRF is an example of that. But SITC is a meeting and they're all about communication. So what I would say is the things that come out, I would go back to my first comment. SITC is 35 years old in terms of this annual meeting. And what's come out of this is immunotherapy has gone from promising to dead in the water to the saving grace of patients, and including and particularly melanoma patients who I said were the poster child. And if you look at SITC over the 35 years, you can follow the whole course of this all the way up to Jim Allison's discovery and Nobel Prize winning discoveries about how anti-CTLA-4 could possibly be used to be effective against patients who have no other hope with melanoma. And the beauty of this meeting is that it was there early through the whole time when nobody believed it would ever work. And then to the great heights it's come to now. I would say without any question, that's the most important thing to come out of SITC is how you can follow this amazing evolution of immunotherapy from, like I said, promise to the lowest lows to the highest highs. And to me, that's been really the most impressive thing that I've seen come out.
Fantastic. Thank you for that, the history and the overview and the tie-in. I think you've nailed it on the importance overall. Okay, let me just make sure I'm catching up with the questions. One thing that is posted, just Dr. Leachman, the website is www.waronmelanoma.org. And that's the website that we talked about earlier in the meeting. I think we've gotten a thank you for sharing, very interesting. And that does cover all the questions. I just want to make sure, Lori, that I did not miss any of the questions that have come through. I was scrolling and I'm afraid I might have missed someone's question. Nope, we're all good. Okay, well, I do want to thank our presenters, Dr. Merlino, Dr. Leachman, and Dr. Twitty, for this Ask the Expert series. I want to remind everybody that this is the final session in the series, but that we are pleased to announce that we will be sponsoring another Ask the Expert series in conjunction with MRF that will be held around the SITC conference. And so the idea behind that is to try and bring forward the scientific updates that come out of this session and share those with you. We encourage viewers to be on the watch for the start of that next session. The first one is expected to be November 4th at 4 p.m. And we hope that you found this series helpful, informative, and useful as you work through your melanoma journey. Again, I want to thank Dr. Glenn Merlino, Dr. Sandy Leachman, and Dr. Christopher Twitty. And most importantly, I want to thank the entire team at the Melanoma Research Foundation for all the work that they do day in and day out to share information, to educate, and to guide patients and their care partners. Thank you very much. Take care, everyone.